My name is Nurse NJ, and this is my story, a true story. It's the story of my fertility journey, but it's more than just a story. It's a lesson. It's a message of hope for every woman and man going through the pain, confusion, and silence that infertility brings. I got married in 2013. I was full of joy, full of faith, and full of plans. Like many women, I believed that once you get married, the next thing that should follow is pregnancy. But from 2013 to 2015, nothing happened. No pregnancy, no missed periods, no surprises, just regular cycles and constant waiting. At first, I told myself to be patient. People said things like, "It will happen, just relax," or, "Maybe it's stress." But 2 years passed, and still no child. That's when my husband and I decided to go to the hospital. We saw a gynecologist. I underwent several tests, hormone tests, pelvic scans, ovulation tracking. And then I was told that my eggs were not active. That was the beginning of a reality I wasn't prepared for. Inactive eggs mean that the ovaries are not releasing mature, quality eggs during ovulation. It's sometimes referred to as poor ovarian reserve or anovulation. This condition means pregnancy may not happen naturally, even if the woman's periods seem normal. The causes of this include age, especially after 35, hormonal imbalances, stress, early menopause, and sometimes unknown reasons. In my case, I had no symptoms. I looked healthy. But my ovaries were not responding. I didn't cry immediately. I just sat still. And then I asked, "What next?" The doctor said we needed to check my husband too. He did his semen analysis, and the result came back showing low sperm motility. Low sperm motility means that the sperm are not swimming properly. Even if the sperm are present in high numbers, if they cannot move efficiently, they may not reach or fertilize the egg. The causes of low motility are many: smoking, alcohol, infections, exposure to heat, tight boxers, poor diet, obesity, and even emotional stress. In some cases, it's due to hormonal imbalance or varicocele. Many men don't know they have this issue because there are no obvious symptoms. That's why testing is important. So here we were, my eggs were inactive, and his sperm weren't moving well. We sat in the car after our appointment, holding hands, and we were quiet. Not because we had nothing to say, but because we didn't know where to begin. We were advised to consider IVF or surrogacy. And I said to myself, I want to carry my baby. I want to feel my baby grow inside me, so we chose IVF. That decision led to a new chapter, a chapter full of injections, prayers, and new lessons. IVF, or in vitro fertilization, is a process where eggs are collected from the woman, fertilized with the man's sperm in a laboratory, and then the resulting embryo is transferred back into the uterus. I began taking fertility injections to stimulate my ovaries. Every day, morning and night, I gave myself injections. The aim was to force my ovaries to grow multiple eggs, hoping that some would be mature enough for collection. I had regular scans and blood tests to monitor my response. My husband also began medications to boost his sperm motility. He was placed on vitamin C, E, zinc, selenium, CoQ10, folic acid, and other antioxidants, and he adjusted his lifestyle. No more alcohol, no more stress, and healthier eating. There are supplements and lifestyle changes that can help improve sperm health. Antioxidants protect sperm cells from damage. Zinc and folic acid improve sperm count and motility. Avoiding heat, wearing loose boxers, and reducing stress all contribute to better sperm quality. When the time came, the eggs were collected, and fertilization was done in the lab. We waited for the embryos to develop, and one healthy embryo was selected for transfer. I lay on the hospital bed during the embryo transfer, holding on to hope. Then came the longest 2 weeks of my life. Every slight cramp made me panic. Every bathroom visit made me pray. And then, after 14 days, we did the test, and it was positive. I was pregnant. That moment changed everything. But my journey wasn't over. At 12 weeks, I started bleeding. Bright red blood. I thought I was losing the baby. I rushed to the hospital. The scan showed that the baby was alive, but my cervix was shortening. I was diagnosed with cervical insufficiency. I needed a cerclage. Cervical cerclage is a surgical procedure where a stitch is placed in the cervix to keep it closed. This is done when the cervix is weak and begins to open too early, which can lead to miscarriage or premature birth. Cerclage helps hold the pregnancy and is usually removed at 36 to 37 weeks. I had the cerclage done. I was placed on strict rest. I couldn't lift anything heavy. I had to lie down most of the day. But I held on. I was determined. This baby was going to stay. Later in the pregnancy, my blood pressure began to rise. I was diagnosed with gestational hypertension. Gestational hypertension is high blood pressure that starts during pregnancy, usually after 20 weeks. It can be dangerous if not managed. It can lead to preeclampsia, early delivery, or complications for both mother and baby. I was given medication and placed on regular blood pressure monitoring. I had to reduce my salt intake, rest more, and stay calm. I went through every stage with faith, fear, and fire in my spirit. And at the end, I gave birth to a healthy baby. My joy knew no bounds. Looking back now, I realize how much this journey taught me. That's why I'm not just sharing my story, I'm teaching with it. Infertility is not a curse. It is a medical condition that can affect both men and women. It is treatable and in many cases, reversible or manageable. But the first step is knowledge. For women, infertility can be caused by hormonal imbalance, PCOS, fibroids, endometriosis, blocked tubes, thyroid problems, and even infections. For men, it could be low sperm count, poor motility, abnormal sperm shape, hormonal imbalance, infections, or lifestyle factors. The key is to test both partners early. If you've been trying for a year without pregnancy, or for 6 months if the woman is over 35, see a doctor. Do the necessary tests. Take control of your fertility. There are treatment options like ovulation induction, IUI, IVF, and even donor programs. But without information, many couples suffer in silence. They waste time. They blame each other. They suffer emotionally. Please don't wait. Infertility is not shameful. It is not spiritual failure. It is not always caused by sin. It is medical. It is human. And it is okay to ask for help. If you are currently trying to conceive and facing delay, I want you to know that you are not alone. Your story is still being written. Don't give up. Don't lose your mind. And don't lose your marriage. Seek knowledge. Get help. Follow through. And above all, hold on to hope. I am Nurse NJ, and this is my true story. From inactive eggs and low sperm motility, through IVF, cerclage, and hypertension, today, I hold my child. And I speak to you with boldness, you too can overcome infertility. If you learned something from my journey, please like, comment, and subscribe. Share this video with someone who needs it. Let them know they are not alone, and they are not forgotten. And to you, the woman still waiting, the man silently worrying, the couple holding each other through the storm, hear me clearly. Delay is not denial. Your waiting season is not your final chapter. Your womb is not empty, it is preparing. Your arms may feel lonely now, but they are being strengthened for joy. Every tear you cry is watering a seed of testimony. Every prayer you whisper is being heard. You are not barren. You are becoming. So rise. Learn. Try again. Hold on. Your miracle may be taking time, but it will come. And when it does, it will be worth every single fight. I am Nurse NJ. This is not just a story. It is a message of hope. And I promise you, hope still works. If you learned something from my journey, please like, comment, and subscribe. Share this video with someone who needs it. Let them know they are not alone, and they are not forgotten. Thank you for watching.